my first choice would not be hypnosis. For some people just quit on their own and they never have to see addiction professional ever in their life. For addiction is a believed to be firefighter response to people's trauma, to people's behavior. Now, can hypnosis be effective way of treatment? You're new to my channel. My name is Eugene Barazin. I am registered hypnotherapist with the state of Washington. I work remotely across the world with gay men, and I provide hypnotherapy and personalized coaching for gay men, especially for gay men who are in the transition after divorce, or in the transition when they're trying to figure out what's next in their life. Also, why I talk about addiction specific, because I am expanding my private practice, and in the near future, not right now, I'm adding addiction counseling. I am actually working towards my SUDP, substance use disorder professional credentials, so that I can actually do addiction therapy and addiction counseling. And while I cannot provide addiction counseling to you at the moment through telehealth independently, I would like to cover the topic of hypnotherapy and addiction specifically, because this is something that I'm very passionate about. And in my work history, I am originally from Moscow, Russia. I worked as a psychologist. I worked as a therapist. And addiction, it's something that time to time I had to work with as a therapist in Moscow, Russia. So to answer the question, if hypnosis is a really option for addiction treatment, it's really important to understand addiction. Addiction is complicated. So addiction it's a disease, and addiction takes over the reward center, right? And it's important to understand why people do what they do, why people use substances. And people use substances either because it is a substitution for something. For example, they crave acceptance, and somehow whatever substance it is can provide that sense of community, sense of, especially when people use substance with somebody else. So this is the function when people use. People use substance as a way to cope and escape. So when people try different ways to coping with stress and with life, and it didn't work out, and somehow at some point they discovered, like, oh, if I use this substance, I can escape my fear. I can manage my stress better. I can navigate life a little bit better. So I'm just gonna go ahead and use this substance to navigate this. People sometimes get prescribed medication, and they become addicted to that medication. And then it becomes physical and psychological addiction, and it becomes really like problematic. Trauma. It's really important to mention trauma, because in a lot of cases with substance, trauma is heavily present. People often use substances as the way to cope with their past trauma. And we see that especially in communities with undervalued or devalued, such as Black, immigrant communities, Asian communities, LGBTQ, IA community, marginalized community that somehow those identities somehow devalued by majority culture. So this context is important because when we talk about how we select a cure for a disease, we need to understand why this disease occurred in the first place and what are the mechanisms and why people do what they do. Now, can hypnosis be an effective way of treatment? And in the description for this video, I will attach SAMHSA's definition, SAMHSA definition of this is something that I covered in the past in my video, Why Therapy Did Not Work for You. And I talk about what recovery means, and I will attach this document again in the description for this video so you can read through it. But recovery is not just stop using. For some people, yes, it is stop using. It's abstinence, it's total 100% sobriety. But recovery in the larger sense is stable health, meaningful life, is finding meaningful everyday future focus. People have plans in hopes for the future, and this is really essential. There are many pathways to recovery as well. It's really important to understand that for some people, it is 12 steps therapy. For some people, it is like for some people just quit on their own and they never have to see addiction professional ever in their life. They just quit. They just can do it by themselves. Some people use non-traditional approaches. They might work with a sobriety coach, they might work with an energy healer, they might work with might work with hypnotherapists to achieve healing ways. Can hypnosis work for addiction? So, through recommended pathways or therapies for addiction, cognitive behavioral therapy is one of the most recommended therapies. Doesn't mean that hypnosis doesn't work, but it's really important to understand the caveat of addiction. We need to bring meaningful life. Hypnosis can work as an additional way of recovery, managing cravings, managing relapse prevention too, as a self-regulation tool, right? And you work with a hypnotherapist or with your provider who is proficient and experienced with hypnosis that can teach you self-hypnosis, because you can hypnotize yourself optimally to manage stress, to manage your responses. And also for me specifically, if I were to use hypnotherapy for addiction, and it's always with connection of something. It's either like I use motivational interviewing in my practice. And again, I don't treat addiction. As of right now, so today is August 2026. As of right now, I don't treat addiction independently. If you work with addiction professional, either with addiction medicine physician or addiction counselor, addiction therapist, and you're looking for new ways to explore sobriety and healing, I'm willing to work with your provider. But hypnosis will be as an addition, as a supplement treatment, not the treatment by itself. More than happy to collaborate with your provider. Just I leave it at that. But also to say that hypnosis is really good at working with certain skill set for recovery. So either we use dialectical behavioral therapy as skill set development to manage everyday triggers, everyday life triggers. And that can be really well utilized in hypnosis. I also utilize the philosophy and the principles of internal family systems, addressing different parts. And according to IFS, internal family system, we talk about and reactive behavior. These are our reactive parts that are protecting us. So, and I am every behavior, every part has a fun for addiction is a believed to be firefighter response to people's trauma, to people's behavior. With IFS in hypnosis, we can work with those firefighters and help them to actually find new roles so they don't have to come back to addiction. So, to summarize this video, and give you a little bit more perspective on hypnosis. Yes, hypnosis can be a tool that you can use self hypnosis as a self regulation, but it's also important to utilize hypnosis holistic with the whole recovery. And for can be you're working with your addiction professional counselor or addiction medicine physician, and you collaborate with a hypnotherapist and you have consent or you have referral rather from your addiction professional to work with hypnotherapist who is highly skilled in hypnosis, who is also skilled in human psychology. That can be a way of for others, like it cannot be well, for some people, hypnosis just doesn't work. And one thing I want to specify precise that choosing hypnosis as the only therapy for addiction as probably would not be my first choice. If let's say if I were to go to a clinic tomorrow and see people with addiction, and I had to choose a therapy method that I can utilize with those people. My first choice would not be hypno. My first choice probably would be motivational interview, would be probably very personalized, person centered, cognitive behavioral therapy with the philosophy of IFS, internal family system. And internal family system is such a like humanistic approach that treats every part of a person with respect and connection with well, probably with 12 steps too can work really well, because I think we're treating and we're treating big trauma, when we're treating big things like that, I think spirituality and spirituality in terms of uh, having larger purpose, having this sense of something larger than us, not just religion. I'm not talking about organized religion. I'm talking about personal spirituality, your personal connection with your creator, your universe, however you understand it. That is the power, because certain really big things we need things larger than ourselves, because I can attest from my personal life, and I went through some really traumatic events in my life. If I didn't have my sense of purpose, my sense of spirituality, my sense of groundedness, I don't think I would be here today, because I went through quite a lot in my spirituality, not just my religious beliefs, because my religious beliefs and my religious affiliation with a certain denomination or church, it's changes, it's evolving, and now it's my faith is not just a church, it's not just a denomination. It is a living, evolving relationship with the creator, like an entity. And it's not just a church, it's not just a building, it's not just a dogma, it's not just like, hey, like whatever this document, this tenants say I have to follow. For me, it's living, and I deeply believe that in order for anybody true like full recovery, leaning into spirituality is essential. And I'm not alone. It's actually scientifically proven. Dr. Lisa Miller actually did a research on spirituality, and she wrote a book, The Awakened Brain. And we have the neural networks in our brain that is responsible for the sense of being taken care of, the sense of belonging, the sense of receiving love and compassion, and those networks. This is the awakened brain, and spirituality does play instrumental role in recovery. And I know there are a lot of opinions about spirituality and recovery and addiction. But from what I witnessed by visiting AA meeting as a part of my assignment, by connecting with people who are in recovery, for so many of them, spirituality was the anchor that actually helped them to see the other side. And that's a really so that's I'm gonna leave you at that. Thank you so much for watching, and I will see you in the next. Love you so much. And if you have any questions, visit my website. You can learn more about me, what I do, and my background. Yeah, if you feel inclined, book a 15-minute consultation with me. Thank you so much for watching.